But just coming back to the hormones, I am a big fan. I'm personally on bioidentical hormone replacement. Can you
Mhm.
comment on the Women's Health Initiative did a massive disservice to women. Disastrous, and I still get that.
Well, let's go back in history again a little bit before that. I don't know if you know this or not, but I was an OBGYN. I was a failed OBGYN resident,
Yeah.
1979 to 1981 for 2 years. I didn't, that was enough for me. But we would do hysterectomies because that's what, gynecologists
That's
would
what we
do.
did. Yeah.
We would give our patients Premarin, which was the synthetic
Oh,
estrogen,
yeah.
right? And we told them they didn't need progesterone because they didn't have a uterus, so they didn't need
Oh,
that anymore. So and we would, and then I remember saying so we would have a post-op clinic, or and for the babies, Tuesdays and Thursdays from 2 to 4 in the afternoon. And I remember saying to one of the senior residents, I said, these women come back. We did a hysterectomy 2 years ago, and they come back and half of them have breast cancer. And they said, yeah, well, that's just kind of the way life is. And
oh,
and
yeah.
and so in 1980, we knew, at least I knew, that was an issue, right? I didn't really put two and two together. So this WHI study comes out. Now remember, Premarin was the most prescribed drug from, I think, 1970 right up into 2002 in the
Shocking.
history of the world. In the history of the world. And if
Wow.
your viewers don't know, Premarin is synthetic estrogen. It was made from the urine of mares.
Yeah, of
So
horses. Yep. Yep.
it has three human, it's 10 different types of estrogen molecules, only 3 of which were human. The other 7 were not. And the estrogen for females is, affects, the female, or sex organs. So it's the breast, the uterus, and the ovaries for the most part. I mean, it does other, lots of other things too. But it should take all of 20 seconds to figure out, why you would give somebody, a highly inflammatory foreign substance that will affect your, sex organs, and they're going to form. So what's cancer? Cancer is,
Yeah.
abnormal cells. Abnormal growth of cells is what it is. So how does the body protect itself from a foreign invader? It builds walls. It builds cells around the organs that are affected. Okay, can you
Yep.
put two and two together now? I
Yeah.
mean,
Yeah. It causes
how long
cancer.
did that take? Yeah,
Yeah.
I mean,
It, it, it,
that should have been obvious.
yeah.
You know,
And that scared women off bioidentical hormone replacement, because that wasn't even a word back then, because it was just hormone replacement. And
yeah.
and
Well,
now, like,
yeah.
people are still scared.
So Prometrium, which is natural progesterone, had come out in 1998, sorry, 1998. And so progesterone is the balance for estrogen.
Hmm.
So the powers that be, and I have this in my earlier lectures, I kind of, we're kind of beyond that now. Said it didn't matter what type of hormone it was, if it was natural, which is chemically the same as we make, or the synthetic, it didn't matter.
Yeah.
It
Yeah.
was all bad.
It does.
Well, it turned out that it didn't matter, and it wasn't all bad. The natural estrogens actually, estrogens and progesterones actually have less incidence of cancers than we gave you nothing at all. So there was a French study came out 5 years later, 2000. What are the 3 big killers of women? Heart disease,
Heart disease.
uh,
Yep.
breast cancer, and cognitive, decline, neurodegeneration.
Alzheimer's. Yeah, which needs estrogen.
And, and what does estrogen protect against?
Yeah.
Right,
Heart
all 3,
disease
and
and
also
cancer, and
right,
yeah, yeah.
and also osteoporosis.
And that's
Bone
a
things. So
major one. That's a major one. Like osteoporosis.
right,
Like my mum is 82 and I have her on testosterone, estrogen, progesterone, something like methylene blue. Like that brings that point up. Like methylene blue could help with a lot of these things too.
yeah. Well,
Yeah.
we really lucked out with methylene blue.
Didn't we?
this
Love it.
was this was it was invented as a dye, a blue dye, in Europe, in Germany and Austria in the 1870s. And the dye maker, the clothing makers noted, those places weren't exactly clean, right? And they noticed that there a lot of the bacteria, about the bug, all the things that were kind of around there. You don't see that stuff in Western movies, or old you don't hear about that kind of stuff, but it was pretty prevalent. And the methylene blue killed the bacteria that if they spill it on the floor wiped it, they wiped it up, and the floor was a little bit blue, but all of the schmutz that was on the floor was gone.
Yep.
So
yep.
About 10 years later, in the late 1880s, scientists took the stuff and they sort of distilled it down, and they made it into kind of a food grade so that it wouldn't kill you.
Yeah. No contaminants.
They used it as an antibiotic, and they used it as an antiviral, and it has antifungal properties. And they used it up until about the 1920s. And then in the US in 1912, there was something called the Flexner Report. And if it wasn't strict medicine or surgery, it was thrown out. And methylene blue, got homeopathic remedies were thrown out, chiropractic was out, herbs were thrown, all of it was no good. And so methylene blue got put into that category. Now, fast forward 100 years, and now we have, these, crazy viruses.
Yeah.
And, think about wherever the hell they came from. Well, bugs like to live. That's why they kept having these variants, right? We do something and get rid of the COVID-1, and then now all of a sudden you got COVID-2. And, whether you think it's a conspiracy and half of it was a bunch of hooey is another story. But methylene blue was an antiviral that hadn't been used for 100 years. And so the bugs weren't used to it. And it was actually quite effective. So, of course,
they stopped that. Because
So
they used it in small clinical trials in people in ICU, didn't they? And they had a huge success with methylene blue, and then it got shut down.
Yeah.
Like everything else.
And we use it in long COVID also now. So, these people that it's, they have these like lingering symptoms, and they've had, neurological damage and and immune damage, that's semi or even permanent. And we've had some very good success with that, along with other things. It's not just one thing.
No.
But the methylene blue was quite a it's sort of a kind of a breakthrough. Sort of gave us something that we could really depend on. The issue was getting it, and then you had to warn the patient that it'll turn their urine blue. So,
I've got blue urine.
It was a little bit of frightening. And again, the VA didn't like that,
It's crazy, like methylene blue, and I highly recommend that everyone go and watch Dr. Clearfield's lecture on methylene blue. It is the best lecture on the internet for methylene blue, and see what it's good for. Like this stuff is amazing.
It's about 20 things.
It makes more energy, helps with mitochondrial dysfunction, helps with hemoglobinemia. It helps with UTIs, which is one of the major reasons that I've used it with my mum. And she's got a blue bum now, but that's okay. Like she hasn't had a UTI since we started using it.
Don't spill it on a white couch, by the way.
No, she gets strict instructions not to tip it over because it will dye everything.
You have a white carpet also. That's probably you're gonna be dyeing it blue. So.
I would love to see methylene blue like accepted in the mainstream. I mean, they use it in the hospitals for things like sepsis in some countries. They use it, for the inducible nitric oxide problems. For carbon dioxide poisoning, for cyanide poisoning, things like that. Emergency, but they don't use it for all the other things that it could be great for. And it's just like, wow, this is easy, cheap, something that could be done. But anything that's easy and cheap seems to get the kibosh. And it was originally an anti-malaria drug too, and it's making a comeback for that, isn't it, as well, because they're becoming resistant to the antibiotics.
So that's okay. We don't want to give out all our secrets. That's why they can't figure. The endocrinologist here in town, if you call them in the morning, they'll say, can you be here by 3:00 in the afternoon? If you call me, I say, can you be here in November? So they can't figure that out.
I love it. So that's methylene blue. Go and check it out, everyone. That lecture is really that really dives into the weeds on methylene blue and is a very, very powerful lecture. One of the other great things that I've, that I love is another drug called low-dose naltrexone, which also has a very interesting backstory that it was used for opioid use at high doses, so like to try to get people off opiates. And then I forgot the name of the doctor, but he started to titrate it down as he was getting his AIDS patients.
But I think his name was Batari.
Yes, that's the one. And he was titrating it down, getting his patients off the opioids. And then he noticed that they started to have all these benefits at the very low levels at 3 milligrams and 4.5 milligrams and that sort of level, that they started to have all these anti-inflammatory benefits. The cytokines were, down-regulated. The immune system was better. Can you tell us a little bit about low-dose naltrexone and why I'm...
Right. So naltrexone is a medication. It's been around since the 60s. I think it was FDA approved in 1984 at 50 and 100 milligrams for it's an opioid blocker. So you can take, if you take naltrexone, it's got about a 36-hour half-life, so it'll last about a day and a half, one pill. If you take it every day, you can do drugs all day. You can drink all you want, and you won't get high.
You won't get high.
You won't get high.
It's a good way to get off it.
Yeah. So why this Dr. Batari in New York City decided to do this, I don't know. So in the mid 80s is when the AIDS crisis came about, and I was actually in Wilkes-Barre. Believe it or not, we had a fairly high population of AIDS patients, and there was only one doctor in town that would see these folks, and you're talking to him.
Wow.
So
amazing.
Because they were all afraid, and everybody was going to die from it. What
just
it was.
like the COVID
thing. All these crazy infections, and one day the guy's perfectly fine, and 6 hours later he's in the ER with delirium, and he had a cytomegalovirus meningitis, and I mean, we never saw stuff like this, and pneumocystis carinii, which are these sort of bacteria. I don't remember if it's a bacteria parasite in the lungs, and where the hell was this stuff coming from? And so they had their immune system was shot.
It's gone.
And their endorphin levels were about a third of what they should have been.
Wow.
So however it came about, when he watered down the naltrexone from 50 milligrams to 5, so he took a 10% of the full dose. It has very different properties. It has one set of properties is that it will work for about 6 hours or 8 hours at a 4.5 milligram dose, and then it wears off. While it's effective, it blocks the opioid receptors.
Yeah.
Briefly, our body's reaction to it is to make endorphins. When the medication wears off, the opioid receptors are open. The endorphins rush in and fill the opioid receptors. So endorphins, or beta endorphin, is the most potent anti-inflammatory that we make naturally.
Wow.
I'm sure you're an athlete and all. Sure you've had like the runner's high, that kind of
thing. Yeah.
It's
totally.
the same effect. You don't get the high, but it's the same effect. It's that kind of but it's that same effect. And so that's how it works, basically. And also
great antidepressive then. So that would this help with antidepressive?
Yeah, everything. Yeah, I mean, there's indications as long as both of your arms and both of your legs.
Yeah.
There's whole societies, dedicated to this now, and there's very specific dosing instructions. We use it a lot for autoimmune thyroid disease. I mean, it's very, very potent for that. But you have to use it in lower doses than even the highest dose of low-dose naltrexone. The thyroid is very sensitive to this, and patients, especially if they're on thyroid medication, will frequently become overdosed. And so we have to watch their thyroid levels, and we frequently reduce their medication. Sometimes we can get them off of it also.
Wow. Yeah.
The other ones that are extremely sensitive to it are MS patients, multiple sclerosis. And so usually the highest dose we'll use now for low-dose naltrexone for most general things is 4.5 milligrams, but for the thyroid and for multiple sclerosis, never more than 3.
Wow. Yeah, and that's another lecture that you guys must go and listen to if you want to really do a deep dive into low-dose naltrexone, and if you